tonight, depending on where you are, I guess, we are so pleased to have a returning guest with us. I do want to let everybody know, especially those who have just joined us, that we are recording this webinar. It will be available post-session. We're asking everyone to just mute during, Dan's sort of presentation, and then we will absolutely do a little Q&A at the end. So please, absolutely, take stock of some of those questions. You can even pop them into the chat, and we'll make sure that they get answered a little bit later. I'd really like to kind of talk a little bit about Dan now that I have mentioned sort of the origins of our kind of coming together and knowing one another. So Dan Levitt has tirelessly championed the rights of seniors for 30 years at the provincial, national, and international levels. Prior to his appointment as British Columbia's seniors advocate, Dan held leadership positions in senior living and long-term care homes in the Lower Mainland for more than 10 years, where he helped shape a dementia-friendly future for seniors and their loved ones. He was an adjunct professor of gerontology at both Simon Fraser University and a former sessional instructor at the British Columbia Institute of Technology. He's also been a surveyor with Accreditation Canada, reviewing quality improvement and person-centered care at long-term care homes and community-based service providers across the country. He is a certified health executive with the Canadian College of Health Leaders and achieved fellowship status in the college in July 2024. Also received the Young Executive Award presented by the BC Lower Mainland Chapter Executive of the Canadian College of Health Leaders. On the global stage, he has recently served as a member of the board of directors of the Global Aging Network and the International Federation on Aging. Dan earned an undergraduate degree from UBC and master's degree from University of North Texas Center for Studies in Aging. He served on the board of directors for the Denominational Health Association, Alzheimer's Society of BC, and is inspired by the aging journeys of his grandparents, great-grandparents, and is now supporting his parents who are living life to the fullest in their mid 80s. And of course, most recently became the seniors advocate of BC. So I am so excited to turn things over to you, Dan, and for you to talk to us today about the work that you're doing,
Sorry, I was
what you
just
are learning, what
logging
you're
into
taking
something
away
here.
from this, and how
Yeah,
we
and then he said the
Ontarians here can also take away from the work that you're doing. So I turn it over to you.
Thank you for that kind of introduction. And I'm honored to be here. And I want to start by expressing my gratitude to the Lekwungen peoples, specifically the Squamish and Songhees First Nations, whose ancestral territory host our offices here in Victoria, British Columbia. So I'm wondering, should I share a screen or do you want to share the screen and then I'll run through the slide deck?
I'm happy to share a screen on the slide deck if you want, or are you able to access it?
Let me just see if I can do it quickly. If not, I might throw it back to you. Let's see if this works. There, and then we'll go to the sec view.
Perfect. I can see that. That's great.
Let me just go to the. Oh, here we go. Somewhere here there is. Oh, there's slideshow. There we go. Beginning. Okay. So thank you. Okay, here we go. So I'll talk about the Office of the Seniors Advocate, what we do, and then talk about some of the issues that we're looking at. And I'm happy to answer questions on the way or at the end, whatever works for you. I'm guessing that some of you will have specific things that you would like me to address or thoughts you have. But so I'll run through a little bit about what our office does. And I will mention that our office was the first in Canada on this purpose, first province to have a seniors advocate. My predecessor, Isabel McKenzie, did this for a decade. I've been in the role now for almost 2 years. And Manitoba just appointed someone recently, Leanne Karen, to be the seniors advocate there. New Brunswick has a seniors advocate, as does Newfoundland Labrador. So there's 4 of us across the country. Obviously, as you know, Ontario doesn't have one. So we have legislation in British Columbia that gives our office authority to do the work that we do. The legislation is called the Seniors Advocate Act. And our mandate is to do systemic advocacy. We don't do individual advocacy. So if someone calls us up with a complaint, a concern of some kind, we'll redirect them And we certainly monitor those concerns to see if there's trends, but we don't do individual advocacy, which some other offices do in the country. So we look at 5 areas: healthcare, housing, transportation, income, and personal care. And we do this in an independent manner. We are housed within the Ministry of Health, but it's really an arm's length relationship. No one has ever tried to influence the outcomes of any of our reports of our work. And we really do have that arm's length watchdog kind of role. So we fulfill our legislative mandate by 4 things: outreach and engagement, which, for example, this is a example of. We do informational referral. I'll talk about that shortly, as well as monitoring senior services. I'll mention that. And also we issue reports on systemic issues, which I'll highlight also. So you recognize the Seniors Advocate. So we have 16 staff. We are probably the largest office across the country that has a Seniors Advocate. We have 6 staff members that all they do is focus on monitoring and research. They're the ones who are looking at the seniors' issues and counting the stats and then writing reports on them. We have an informational referral line for staff members, staff that those phones Monday to Friday. If a senior calls us, we answer the phone, which is kind of unique these days. And we can provide a referral service or information to help them along their way. And we have 6 other staff members who make sure the office runs smoothly. And also we have a communications team that is part of that role. Communications is a really important function of our office to make sure we're getting the message out. So our informational referral line, there's the number. If you try calling the number, you'll speak to somebody directly. So it's usually helping them navigate, the senior or family member navigate through different community services or government programs that exist. We will help provide information that they're seeking. Usually it's navigating the healthcare system, which is all too complicated. And if they want to escalate or need to escalate their concerns, for example, waiting too long for long-term care, or once you get into long-term care, not having the services that they expect to have, we give them advice of who to call next for a complaint. And then we also monitor those calls we get, and then we will direct them and escalate them in terms of a report that we'll write. And we've done some reports based on the number of calls we get and why they're calling. So common inquiries we get, I mentioned this already, but just navigating. If you were to start a new business, around seniors issues, I would have a navigation service starting. It's something that isn't always done well and where there's room for improvement, especially longitudinal navigation. It's one thing to connect somebody with a service today, but it's really that ongoing support seniors need. Primary care is a major concern across the country, and I do appreciate the work that Jane Philpott's doing in Ontario around having geographic areas where if you live in that area, you are automatically part of that primary care group. I think it's a great model. But we definitely get calls about that around access to a doctor or to nurse practitioners. Cost of living is a big concern. Rental housing, although rents have gone down recently, if you're living in and renting, and you've been renting in the same place for a few years, you have not enjoyed those rent reductions. You actually see it going up, as well as groceries. We all know those have gone up, and other items. So the cost of living affordability is a main concern. Home support is a big concern because there's financial barriers. If you in British Columbia live on $30,000 a year, you're required to pay $9,000 a year, 1/3 of your income approximately, on 1 hour of home care. And in Ontario and Alberta, they don't have that home care charge. And it's certainly something we're advocating for, as well as having a more robust funding for staffing. Staffing shortages are causing appointments to be unmet. And then, of course, around acute care, we do see a lot of, again, phone calls around people who are needing acute care or are in an alternate level of care bed waiting to be discharged. And then there's not enough affordable housing. About 14,000 people in British Columbia on the wait list right now to get affordable housing. And the SAFER program, which is a subsidy for low-income renters, is woefully inadequate in terms of the goal of the program of 30% of your income being spent on rent. We just aren't even close to meeting that target, and there's lots of improvement the program needs to make in order to help seniors on low income. These are seniors who are getting the Guaranteed Income Supplement, GIS, or seniors who are living, for example, on $2,000 a month, which is about a quarter of all seniors. 1/4 of all seniors in BC are living on $2,000 a month, and in many cases, a lot of that money is going to rent. And then, of course, there's digital divide, the digital inequity in our country, and unfortunately, more and more, you have to use that technology to access services. And this is not a matter of seniors not being tech savvy. It's about the affordability of that technology, and not just buying that device, but actually being able to afford the Wi-Fi and that kind of access. So those are some of the main inquiries we get from our information referral line. Then our monitoring and research line, our offices, will do jurisdictional scans to find out what's going on in other provinces and what improvements could be made. We'll look at the literature and look at emerging issues, and then all this information together helps us inform what programs and services we should do a deep dive in and do a systemic review on. So we'll do both the qualitative, which is often hearing from caregivers or family members, seniors who are experiencing that challenge, and also we quantify the data to make sure that both the qualitative piece, the experience, and the numbers compute, and that the two support each other. Then we do these reports that we issue. So the different areas, as I mentioned earlier, that we might report on could be healthcare. So it could be everything from access to a primary care physician all the way to hospice, end-of-life care, and everything in between, long-term care, assisted living, how long you're waiting for a hip or knee replacement, vaccinations. All those things are potential things that we would write reports on, and we definitely monitor those stats every year. Then we look at community supports. What kind of community centers or services are available for seniors to age in the communities where they live, so they can stay in that house around near their family and friends, and go to the same coffee shop or a grocery store or bank that they're used to going to. So we want to make sure that our province is age friendly, and that ideally there's a seniors plan in each of those municipalities where seniors live. Housing, as I mentioned earlier, renting. We're seeing more and more seniors in precarious housing, and more seniors at the risk of homelessness. And unfortunately, seniors are the fastest growing group of people who are experiencing homelessness for the first time in the second half of their life. And then those people who own a house, how can they stay there when they're house rich and cash poor? And one of the things, for example, in BC we have is the ability to defer your property taxes. So we're encouraging seniors to consider doing that, to put money into the pockets today and defer that payment, those taxes, until the house is sold. Transportation, 20% of seniors don't drive, so they rely on public transportation to get around. And that's one of the areas we hear about quite a bit. And especially if you live in rural province areas and in parts of Canada, good luck getting around. And then the other piece is those seniors who are driving. We want to make sure that everything is done possible to help them drive for as long as possible. As long as they're safe to drive, they should be driving. But there's a cost to that, and the doctors in BC can charge whatever they want, pretty much, for up to about $300 for that medical examination that's required every 2 years after the age of 85 to prove you're fit to drive. So there's more work that can be done to ensure the roads are safe and seniors can get around, and that they're not isolated, lonely, and socially excluded. The last area, which is the number one thing we hear about, is income. The half of seniors in BC, the median income level is $37,000 a year. That's just approximately $3,000 a month. And for many people, they have no money left over at the end of the month. And this is not the kind of golden age that many of us imagined. So some reports we do annually. We have this long-term care and assisted living directory that we publish every year. We'll be releasing it next week, I believe, on the 27th, last year's report. It's really a directory information, the number of staff, direct care hours, how much each home pays for their food. Unlike Ontario, there isn't a food spending requirement in BC. And what else does it cover? It covers the number of, or what percentage of residents are getting chemical restraints, especially when they don't have a diagnosis. And we also look at the number of long-term care beds in assisted living, which actually have assisted living beds have gone down the past year. Meanwhile, only about approximately 500 new long-term care beds have been introduced. And with the population growth in the number of people who are going to need those beds, we need to build in BC approximately 2,000 beds a year in order to hit the number that we need, which is a 50% increase in the next decade. So we're monitoring that area. Our bigger report is this one, which we'll probably release in the springtime or end of the winter, which looks at all the areas and has a lot of details. One of the things that usually gets the media's attention is around elder abuse, and unfortunately, cases of violence towards seniors is increasing both at the municipal and provincial level when we look at those statistics, and it's unfortunately going the wrong way, and especially with financial harm also. The annual report we do, which highlights our activities as well. So our last report we issued was on long-term care, and I know in the province of Ontario, the ministry responsible for long-term care promised 30,000 replacement beds and 30,000 new beds, approximately 60,000 beds altogether. And when we look at those numbers, BC's numbers should be 20,000 beds, and the provincial government estimates we need over 16,000 beds in the next decade, and that would be a 50% increase from the current bed stock. So the system here is under strain, immense strain, and I know in Ontario there's lots of stories about seniors leaving the towns where they live and usually living somewhere outside of the city around the metropolitan area of Toronto. It's happening in BC too. Unless you're a married couple, the likelihood of you living nearby is greatly diminished because we have not built enough long-term care in the places where seniors would like to call home if they would need a place to live like that. So what we've seen is the wait list. So the number of people on the wait list has increased over the past decade from 2,300 people just 10 years ago to today 7,200 people. That's a 200% increase. Now, if you're a statistician, you know that percents only go up to 100. So just imagine what this does for our economists who look at these numbers. So just it's hard to imagine that there's that many more people on the wait list, and that number's going in the wrong direction. It's only going to increase because of the lack of building that's happening. And then when you look at how long we're waiting now, we're waiting almost 100% longer. So the average wait time used to be about 5 months. Now it's about 10 months. And we're seeing that there's variability in the number of days that you wait, depending on where you are in the province. But just think about it, 10 months, a senior is waiting for long-term care. That's on average. That includes the admissions from the hospitals. So that means if you're waiting in the community, you're probably waiting over a year for a bed. And what we're seeing, which is unfortunate, is that families are now taking the burden. It's the family caregivers who are taking the responsibility on rather than government. And it's costly both to their health, to their mental well-being, and to their pocketbook. So this is really something that we're very concerned about. We heard from 900 caregivers when we did a survey last year, and we heard things like this is the hardest job they've ever done. It's affected them, their health and well-being, and it's put many seniors on the edge and not knowing who to turn to, and really hopeless for a future, and really considering alternatives that none of us would want any senior to have to consider. So that's unfortunately the state of long-term care. I wish I had better news to tell you. A little bit about BC. I think if you probably, we're 1/3 the population of Ontario. I didn't look at the stats, but you could probably just amplify that by 3%. You probably have around 3.3 million seniors, I'm going to guess. So that's today. So in BC, we have 1.1 million seniors. So for every person in BC, 1 out of 5 is a senior. Fast forward a decade from now, it'll be 1.5 million, an additional 400,000 seniors In Ontario, that's likely about 1.2 million. And by then, in 10 years, 1 in 4, so 25% of everyone will be over 65. So that's good news. The oldest baby boomer, she's 80. She just turned 80 on January 1st. And then in a decade from now, she'll be 90. And why is that important? Because at 85 things start to change. That's when we need more care, usually. 1 in 3 require care. The other third over 85 are providing care to that person. The other third will never have to worry about any of this stuff. But we need to make sure that the caregivers and the care recipients are well taken care of. So there's more seniors, they're living longer, which is good. As you can see, 12% today are over 85. In a decade, 17% are over 85. Just two cautionary things to consider when we look at these kinds of numbers is when you hear someone talk about the demographic trends, when they mention things like the silver tsunami or the rising tide or the gray wave, whatever they want to call it, listen to what they say next, because that's what concerns me. I'm not that concerned about how they call this this wave, because we sometimes need to amplify and put a bright, hot spotlight on it. However, often the next thing they talk about is it being a problem. So what are they really saying? From my point of view, it's an ageist tone that suggests that aging is a problem. And aging is not the problem. Growing old is a gift, perhaps the best gift we could ever have dreamed of as a human race, being able to live longer. That's an incredible achievement. And everyone in Canada, by the way, should be able to enjoy that longevity bonus, which unfortunately is not extended to everyone, especially our Indigenous population. That really should be a focus of the Truth and Reconciliation in our country. But what I really want to focus on is the fact that the narrative should be aging is a good thing. Aging isn't the problem, ageism is. And likewise, another example of ageism would be characterizing all baby boomers, which some of you might be baby boomers. Those are people born right after World War II up till the mid-60s. So if you are in that generation, you're either 60 or 80 this year, in that range, a 20-year period, you're not all the same. If you've met one 80-year-old, you've met one 80-year-old. To suggest that one group of people are all the same is called a stereotype. So when they say baby boomers or Gen Ys, Gen Xs, or millennials behave a certain way, you might vote similar, you might have similar spending habits, but you all are diverse and different. So you're a heterogeneous group of people. So you're not a stereotype. We should be pushing back on ageism is really the point there. So some quick snapshots here. Another myth about growing old is that you use more than your share of government resources. And that's not true. 95% of seniors in BC live independently. And my guess is if you look at your Ontario stats, they're similar. It does change, as I mentioned, at 85. 3/4 of people are living independently. And then where are they living after 85? Well, they're living in assisted living, in long-term care, and the other, I guess, how's my math, 12% or 13%? No, 12% are living at home. And the other third are caring for that person. The other third are dancing and romancing, and they'll wish the music would never stop. I mentioned the homeowners piece around they can defer their property taxes if they want to. Let me jump into, but we need to make sure that seniors can age in place where they live. I was just visiting a couple in their 70s today. They showed me their house in a nice part of Victoria, and not the nicest part, but a fairly decent part of Victoria. And they had converted, it's probably 1,100 square feet basement suite for a mother who's since passed away. So they had 2 generations in that house, and they were living together, and they were able to buy the house because they combined the daughter's and the mother's income or assets together to accumulate the house. And I think when we start thinking about aging, we got to make sure that we're considering all housing options and really rethinking what it means to own a home and what it means to have multi-generational. So sometimes we think about it's someone else's problem to create, but imagine living with your kids, or I can imagine myself living with my parents, which I do when I'm in Vancouver where they live. Okay. On top right, 15% of seniors continue to work. As you would expect, less seniors are working for every 5-year increments. But one of the inequities, and I would say this is age discrimination, is that you can check the stats in Ontario as well, is that when you work past 65, you lose benefits. So if you're a municipal, a provincial, or a federal employee, you no longer get certain benefits at 65. And in British Columbia, it's your long-term disability. If you get injured or can't do your job mentally or physically for some reason, you don't get coverage, but you do at 64. And then you lose things like group life insurance and something called accidental death and dismemberment. So we have someone here, she just retired, but somebody who was in her mid 70s who was on the phones for the information referral line. So she didn't get those benefits. And then at 71, she lost her ability to contribute to the pension because of the RIF. I never understand that, the connection, but she can no longer contribute to her pension. So the person in the cubicle next to her had more benefits than her. And if that's not age discrimination, I'm not sure what is. Another stat, interesting, I don't have it here, which is over 40% of seniors volunteer. Without seniors volunteering, a lot of stuff doesn't happen. I've mentioned already the middle one there. And then, the other thing I like talking about is dementia. Many people have this myth, an ageist myth, that if you live long enough, you will get dementia too. It's not true. You may have short-term memory challenges, but those are much different than dementia. If you can't remember what you had for lunch yesterday, it's not a concern. If you walk up to somebody and you don't remember who they are, but they know who you are and they tell you stories that are fairly recent, it's okay that you don't remember that. It happens to all of us. But that's not dementia. That's short-term memory differences, which are manageable if you have certain things you do. Okay, so here's some of the current issues that we're looking at right now in BC. Obviously, housing is a big concern for us, making sure there's enough housing, the right kind of housing for seniors. Then, of course, living and affordability is a big issue. And then just making sure people can age in place where they live. So having access to adapting your house so you can live there, modifying your home so you can have things like walk-in showers and grab bars and adaptable cupboards so you can actually get into your kitchen and still use it, transportation wherever you live, and things like adult day programs we're very concerned about because this is one of those things that's low cost to operate, low cost to start, and could be available just in every community in the province. The long-term care wait times I've mentioned already, and the biggest one really is, which I think colors everything here, is ageism, is the devaluing of people. The devaluing could be if you walk into a store and you don't see yourself being represented in the advertisements or in the magazine covers. And when you go to a store to buy clothing for maybe a grandchild or for yourself, they ignore you. But they're happy to help people who are the right demographic. Could be that. It could be going to your doctor's office. Your doctor says that's just a sign of growing old. If you didn't hear that yourself, it's unfortunate, but sometimes there's medical procedures, diagnostic tests that aren't available for people at a certain age. And if you're not with me yet on this point, think about menopause. Do we really have the right kind of treatment for people who choose treatment or who will consider it when they go through menopause? And I think that's not just ageism, it's also sexism. So there's a lot of work we need to do in our country to address current issues seniors are facing. So let me the last piece, and then we'll have a chance for some discussion, is the myths of aging. So here are some myths. Older people are unhappy. So if you think of the movie with Walter Matthau and Jack Lemmon called Grumpy Old Men, it's perpetuated in Hollywood stereotypes about older people being unhappy. And by the way, I'm always concerned when I hear someone talk about a building as being old and tired. I heard that recently, and I'm like, that's an ageist term. You wouldn't say that describing somebody else protected under the Human Rights Code. And it's not, this might seem subtle, but I think it translates into how we prioritize people in society. So I'll talk about if you're really unhappy. Seniors are wealthy. The suggestion all seniors are rich. Memory loss is a normal part of aging. Oh, seniors can't use technology. There's lots of stuff online about that. And then older workers aren't as effective as younger workers for example, this idea you can't teach an old dog new tricks. Well, here's the reality. Older people are happy. Life satisfaction actually increases with age. And there's a U-shaped curve like this. So if you start beginning of life, think of my great nephew, Miles. He's 4.5. He's one of the happiest guys at the party. The other guy who is the happiest is over here is my dad. He's 88. The two of them are happy. Everyone else there has mortgages, has concerns, day-to-day things. But those two guys seem to be the life of the party and not a concern in the world. And in fact, the two of them are starting to have an online game that they're playing together. So they're enjoying life to the fullest. Many seniors are not wealthy. Half of seniors, as I mentioned, in BC are living on $3,000 a month, which is certainly not wealthy. Dementia is not a normal part of aging. That is a myth. If you grow old enough, you're not going to get dementia necessarily. It's more common in old age, but old age does not cause it. Old age also doesn't cause death. If you ever hear someone say, what did they die of? They died of old age. They did not die of old age. And in fact, doctors are not allowed to put on the death certificate cause of death, old age. It's pneumonia or something else. And even pneumonia is preventable by vaccinations or by proper oral care. Seniors are more tech savvy than ever. That happened during the pandemic. And being tech savvy isn't really the issue for seniors. It's actually affordability, not be able to afford the device or the Wi-Fi, as I mentioned. And the last is older workers are effective. If you look at those myths about older workers missing more days off or being more costly for benefits, etc., it's not the ability to work and be productive in the workplace is not determined by your age. And in fact, when we think about workplace and ages, younger people actually experience and report more ageism than older people do. So there's some myths. I think that's it. I'm happy to answer any questions about any of those topics or anything at all you have. And I'll do stop share, but I'm happy for, you can send my contact information around and happy if anybody wants to contact me afterwards also. But I'm looking forward to hearing your questions or thoughts.
Absolutely. Well, thank you so much, Dan. That was wonderful, and I was actually jotting down quite a few notes. So I do have some questions, but and maybe what I can do is toss one out while we're waiting for folks to maybe formulate their own in the chat. We can also, you can certainly unmute and raise hands and all that, but maybe I can just throw this one out because obviously Concerned Friends is, as an organization where we do a lot of advocacy work around long-term care, and that is our focus. When you were talking about wait times and obviously even just capacity, I do recall from when you came to us back in 2022 that you're very much a proponent of the dementia-friendly homes, of homes that feel like homes and are often, smaller, or at least not institutions. And so I guess I'm curious to know, what your office has been looking into, what maybe sort of things are being proposed in BC as a way to address this issue of, needing quote unquote beds, but in a way that is actually going to be supportive of quality of life and experience as people age.
Well, I'm glad you asked the question. When we look at the buildings that have been announced by the government, these are often the care homes that are next to the hospital, and they're often larger, and they usually in BC they're often the homes where more complicated complexity of seniors will end up. So we need to have those, and the way they're building them right now is they're building many people in one of those buildings, hundreds of people sometimes. And I think Ontario is building a fairly big one also, and there's probably a number of them. So our office could have taken a position and said, don't build any of those. My thought was around we need to get those beds built. They may not be the ideal, but we'll be monitoring the quality of life, the experience once they're built, and we expect they will be providing the best possible care they can experience. But what we've seen is because of the cost of building going up, we've seen a push back on trying to build these places cheaper. And when we look at I'm kind of trying to keep my thoughts without looking at the line of the questions coming in. So one of the things that I'm really encouraged about is that the small house model. So we actually are seeing one of the health authorities here where they were going to build, or I think they're still building, a very expensive care home, which are pushing the dollars down for the building, but at the same time they're buying single story ranchers, we call them, and they're going to convert those ranchers into a 12-person care home, the greenhouse model, the small home model, and they'll have a multi-skilled worker there. It'll be geographically close, maybe a kilometer or two away from, if you will, the hub of a care home, and they'll figure out how to make all that work. But they're going to be building them a lot cheaper. And my belief is that I'm trying to think of some small towns in Ontario, but where I credited, they all had care homes, but there probably are communities in Ontario where seniors having to leave that town because there aren't any care beds. So one of our examples is there's a city in BC called Chase. So Chase is just at the bottom of the Shuswap. If you know the Okanagan, it's at kind of the northern tip of the Okanagan. You can drive about a half an hour or so south to Vernon, about a half an hour the other to east to Salmon Arm, and then about 45 minutes to Kamloops. But there's no long-term care beds in Chase. So one of these small households could be set up there. I think that would address the issue. So that's really what we're pushing for and advocating for. And we're really pushing government to make sure seniors don't have to leave the town they're in or the community, the neighborhood to get care. They shouldn't have to leave town. And my comparison is in school catchment areas, you don't need to leave that area to make sure your kid gets school. We should do the same thing for grandma.
Absolutely. Yeah. No, I love that. And I'm excited to hear that that is something that is in the works as well. So I'm seeing, is it Shala? I'm seeing you have your hand up, and I want to go to you first, and then we'll jump into the chat questions.
Hi, everyone. Thank you very much. Thanks a lot. Thank you, Dan. It was amazing. Thank you to all of you that prepared this. I am from Richmond Hill, Ontario, and I've been in Victoria. And between the other different part of the Canada that I've been to, I think that Victoria was the one. If my boys were not here in downtown Toronto, I would jump and live in Victoria. To be honest with you, Victoria was the one that I find out that my husband is paraplegic and then he's using a wheelchair. I never been in any part of Canada that I enjoy as much as I did in Victoria because it's very accessible and I cannot believe it that why we don't have, maybe I am wrong, maybe there are other parts. I've been to so many different parts of Canada, but I don't know. But Victoria was amazing. And that's always my model when I go to, like I am part of the, Richmond Hill City, part of the accessibility committee. And I always make that as an example because I have even pictures that I show the committee. And I said that why we don't have this, like why we don't have the bed to go up and down, even in walking clinic, all of these different things that I have two questions. One, that is there, why do you live in Victoria then?
Yes, actually, I was born here, and I actually have a house in Victoria now, and I have a daughter who goes to UVic, the University of Victoria, it is a beautiful spot. I also lived for a couple of years in North York, and I worked at Baycrest Center, so just a little bit south from Richmond Hill, and I have fond memories of where you live too. And I think what you're describing, this is probably not your question, sorry, what we're describing, I think, is this idea of age-friendly. And for me, it's that if you think about the disability movement in America, they called it the American Disability Act. There's a similar act, I think, in most provinces where accessibility was. So you think about crossing streets or those curb cuts didn't exist 50 years ago. That's new. Traffic lights, making sure that you can actually get across when you're crossing the street, but it's much deeper than that. It's making sure that seniors have what they need in the communities where they are living. But Shayla, you had a specific question, I think.
Yes, I was wondering that why do you think that the Victoria is so ahead for some of the accessibility and some of the requirement? That's one question that I have. The second one, that do you have anything, because you are the advocate, have you ever work in the area that, like, encourage government to put some requirement for all these builders that when they want to get approval, they have to have at least a few apartments that it's really age friendly, because we are looking, we have to sell our house, and you cannot believe it. Like last 2 years, we are looking and looking, but any apartment that we want to purchase, we have to spend lots of money to make it age friendly. But even though there are so many new buildings, that's my specific question: that do you have you ever worked in that area also to advocate or not? Thank you.
Okay, so maybe I'll answer the second one first. I'm still new at the file and on this job, so 2 years. I haven't really looked at building codes or those requirements, but I know that, to your point, when they're done right, you can age a place. So we're talking about adaptive housing, where you have, if the grab bars aren't already installed, you have the wall that's reinforced where the grab bars would go, by the toilet, by the bathtub, and then you have things like your kitchen counters and cabinets that are adjustable, so you can get a wheelchair underneath, etc., and flooring, and you think about the ramps or all those things. So those are things that really should be done in if we're being age friendly. Remind me your first question. Why is Victoria so wonderful?
Why, like, what is the reason it's so different?
Well, I think, well, first of all, everyone probably on this call knows we don't really have winter here. If you think about the freeze thaw stuff that you're dealing with there and the roads, there's a much less. We have probably salt because we're by the ocean, but have more probably saltwater issues with. But let me get really to the point. I think the answer really of this is advocacy. Is that the more you advocate, I think the stronger and the voices of getting stuff done. So I think it's probably the number one thing is you have people who were committed citizens. They rolled up their sleeves. They made the change. They volunteered to be on city councils, or they just got involved. I think that's probably the key thing. So
thank you very much. Thanks a lot.
Of course. Thanks for the words.
Thank you. So I have kind of two, I guess, home care related questions here that maybe I can toss out and get you to kind of answer them together. So one is from Grace. In Ontario, home care is very limited, very restrictive, confined to personal care delivered by personal support workers. Is that also true in BC? And then Lorna, I think, was also asking for some clarification on that $9,000 contribution requirement for home care. So maybe you can tell us a bit about that.
Sure. So in Ontario and Alberta, if you were living on, say, $30,000 a year, which is around, say, the 40th, 45th percentile of all seniors. So if your income is like your tax return is $30,000, and you need 1 hour of home support. So 1 hour of home support for the whole entire year. At the end of the year, you will have paid $9,000 for that 1 hour per day. There's 1 hour times 365 costs you $9,000. So now you've gone from down to about the 25th percentile of income for seniors. And now you're facing, what do I give up? And it actually pushes people to move into long-term care prematurely. So about 10%, we think, of all people in BC who are in long-term care don't have to be there, but they're there because they qualify and because it's more affordable than paying for all the other expenses. I'll mention that in Ontario, when I was doing accreditation surveying, I remember being either in Thunder Bay or in I'm forgetting the other city where it might have been. Anyway, north of Toronto on one of the lakes. Anyway, I'll tell you that I visited a community-based care system, and they had a home support program, home care program, and they were pretty much, at the time, this is a few years ago, they were pretty much 100% compliant on any appointment they booked, they met. And if they didn't meet the appointment for some reason, they investigated and made sure that that never happened again. So I admire the way that the home care system is organized in Ontario. I think the staffing piece, at least my perception was it's good. And also I found that the co-payment's not there, but it is limited. And unfortunately, the idea of doing homemaking is separate. So it could be something really simple that helps the senior stay independent. But sometimes, unfortunately, government has to ration the amount of hours they have. And sometimes they start to to pull in the services that you can actually get.
Great, thank you. Well, the most of the other questions are basically the same question over and over again, which is essentially helping us to understand kind of what the catalyst was for, establishing an office for the seniors advocate, and how essentially we can go about here in Ontario advocating and getting one established.
So I think the origins really, I've heard the story a few times. I heard it mainly before I got this role, but there was, I guess, 15 plus years ago, and it came up a number of times in the opposition wanted to see a seniors advocate, and there was a number of things that happened at the provincial level that really upset seniors. So one of them was the government at the time, which was more of a conservative government. They basically got rid of the homemaking services, and they privatized home care, and so all this stuff, the non-clinical piece of home care was eliminated. That was one thing. It was kind of upsetting, and there were a number of things like seniors being separated. One senior who needed care went to one town, the other went to another town, maybe an hour from each other in BC, maybe a mountain pass on a highway separated them, and one couple died separately. You look up the Albo case, ALBO. That's a kind of famous case, and there was a few too many of these stories that were going on, and so we have a child commissioner in BC. We needed somebody for older adults, and also there's no UN convention. They're writing one now, or starting to write one in Geneva, but there's no UN convention. So I think a lot of advocates were out there, and the other piece I would say that really pushed us forward also is who was advocating. It wasn't just seniors; it was senior serving organizations, and the labor movement really was pushing for this also. In particular, the ones who were working in care homes, who really were pushed aside. It was a strong labor union who I think wasn't really in sync with a conservative government, and some stuff happened, and I think that led to a movement to get the office established. And I'd love to have if my predecessor Isabel was here, or the other people who were involved. But it was really interesting when they were going to create the legislation for the office. They did a consultation process, and they looked at what age is a senior. They were looking at different ages. What should they do? Do they do individual advocacy, systemics? How can they do the most work? It was an interesting time. So this would have been. So how can Ontario do it? I think obviously you need the government of the day, or the government in waiting, to put it in their political platform that they're going to create the office. And then you want to look at what are those big issues that seniors are facing that the government's not really addressing. And I think that would really be, I think, your biggest push. And I do think long-term care is a big one. And we're focusing on it quite a bit. That's my background. And I know it's something that gets a lot of attention from some seniors, and it's very real. So I think it'd be that issue and other issues that you want to focus on. And you probably want to align yourself with other senior groups. Another person would be worthwhile talking to is Laura Tomlin-Watts from CanAge, and CARP also. I think both groups would probably have some insight around this.
Yeah, absolutely. There was one other question here that I am curious about, because you did mention, of course, the other seniors advocates across the country and other parts of the country. Have you worked with any of them on federal initiatives?
Yeah, so we actually just met yesterday, and so we were welcoming the new Manitoba Seniors Advocate, and before my time, Isabel, when she was in this role, they went to Ottawa, met with different political elected officials and staff members there. But really, when we think about some of those common issues, so one of them is obviously senior services for Indigenous, making sure that they're available and being supported. Many things around CRA, so survivor benefits, or you probably know that if you're a single person senior, you're worse off financially in terms of tax incentives or non-incentives than someone who's married. One of the issues the federal government and also the opposition have looked at is the idea of RSPs to RIF conversions. So reducing, so the Liberals promised, I can't remember how, oh, I think it was 25% reduction for 1 year of the RIF, of your RSP to a RIF. They have not put that into the federal budget. So we're looking at that. And then I know the Conservatives were promising a 1 year relief. So the idea that at 71 you have to start converting your RSP to a RIF, something that I think, I know CARP is a strong advocate that it should be the individual's choice. The government's going to get their tax money regardless. You're not going to, that's not really the argument. I mean, many people don't want to pay taxes, I hear from seniors, but they've got the benefit to begin with. And so if you had, so right, many of us forget that the RSPs you contribute to, you've already received the tax rebate. So you're just deferring those taxes down the road and you're at a lower tax rate. That's the general concept. More money for infrastructure, for seniors housing, for long-term care. We want to see more of that. Another issue we're looking at is the National Dental Plan. We want to make sure that that's being rolled out and it's easy for all dentists to subscribe to. Just as a note, when my own personal dentist didn't sign up, I refused to go. Before I had this job, and he bumped into me somewhere, and I had to call his office. And even when I went there for the appointment, I asked the staff there to prove to me that they actually were on it. So before I went back, I had a bit of extra work I had to do after not seeing my dentist for a while. Another issue is pharmacare. We want to see that the pharmacare program being rolled out properly. And there's the aging with dignity money. So there's a number of other things that are like that. So those are issues. And of course, CPP and OAS. I'm concerned that there's some, I would say, ageist viewpoints on that, and that if you can give tax incentives or tax breaks, you should give them to younger people. And I'm not saying you should give them to younger people, but I'm saying don't take them away from seniors.
Amazing. Well, it sounds like you've been very busy, Dan, since we last saw you. And I'm so appreciative of the time that you've given to us today, and you know, I'm always just inspired to learn about the things that you can share with us, and it, you know, makes it's having been involved with Concerned Friends for so many years now, you know, you always bring the good stories, the good news stories to us, and the things that we can reach for and advocate for. So I'm so appreciative of that. Um, thank you. Thank you again.
Anytime.
Yeah, absolutely. We'll take you up on that for sure. I want to thank everyone for attending tonight, and just let you know that of course, we will be doing another webinar in April, which will actually be a little bit more focused actually on new research around long-term care inspections and regulatory compliance. So if you really like to get into the nitty-gritty of that, I think it will be very interesting. And we are also really keen to get anyone who wants to be involved with Concerned Friends to join us. We are a volunteer-run organization. We have openings on our board of directors. And honestly, the last 5 years that I have spent with some of these very incredibly wise and inspiring folks on the board has been, you know, some of the best moments for me. So if it is something that interests you, we really welcome you to reach out to us, because we would love the company and folks who are also equally invested and interested in the work that we're doing. One last thing before we wrap up is when we close out of this, there will be a little pop-up survey. It's short. I think it's like 4 or 5 questions. If you have any feedback to share, if you have any ideas for future webinars, anything at all, we would love to hear from you. So please feel free to provide that input. And otherwise, I wish you all a wonderful evening. Thank you so much.
Thank you.
Thank you.
Thank you.